Good afternoon once again. Today is Tuesday, the 29th of December, 2020, and this morning we had the weekly cabinet meeting as we have every week. Of course, we're here for the English language version of the CCSA daily press briefing to provide and talk to you directly, provide the information to the English language audience viewing within Thailand and from the broadcast on social media around the world as well, and also for international journalists as well. I'll be recapping the issues that the spokesperson, Dr. Tuisin, had briefed just now, and additional issues that are relevant to the international audience in particular. Of course, the statistics today, you see that the global numbers, we have reached 81 million infections around the world. In Thailand, of course, I think we're still in a good standing, but we still have to be very careful. Dr. Tuisin just now summarized three possible scenarios. The worst case scenario is, of course, if we have no measures or no compliance at all, we lack in compliance, it will be possible that Thailand will be facing over 10,000 infections per day. That is the worst case scenario. The moderate scenario sounds better. The best scenario, of course, is that all the measures are abided by, are complied with, and that will, of course, bring in daily infections to a lower number. So hoping that this worst case scenario that I mentioned will not happen at all. The spokesperson also mentioned about that tomorrow there will be a release of information regarding the categorization of the different provinces. As you know, we have categorized the different levels for each province. Level 1 being highly controlled zone, level 2 controlled zone, level 3 under high surveillance, level 4 under surveillance. Now, the level 1 highly controlled, of course, that is the epicenter of the clusters like Samut Sakhon and municipal district of Rayong province currently in level 1. But tomorrow there will be a release of additional information, meaning that the different district levels, the Ampere levels around the country will also be categorized in the zone levels that in terms of their infection with COVID. So that will be a more detailed information provided tomorrow onwards. That being important, of course, we highlight the importance of the village health volunteers, and more than ever today, the strength of the village and Tambon sub-village administration officials, which we have helping us to fight against COVID around the country in the local communities. The spokesperson also mentioned about the 7 days of danger, as you have heard, 7 dangerous days, which of course is the 7 days that run through this period every year, through New Year. 7 dangerous days because of the high rate of road accidents. And that, of course, is still something that we still have to be careful with. But of course, 7 days of danger is also relevant in the context of COVID as well. So we'll keep an eye out for that more rigidly, and for all of you as well from the audience. Moving on to Samut Sakhon, the governor of Samut Sakhon tested positive for COVID, as you saw in the news, 1 day after receiving the public health minister, Minister Anutin, and other senior health officials on their visit to the province. The virus was contracted during his visit and exposure to high-risk areas, meaning, of course, while on duty, while at work. Of course, we send him and all the frontline healthcare workers our moral support for their dedication and efforts. Mr. Anutin, in particular, the public health minister, and his delegation has since been tested negative for the virus, but have been placed under a 14-day quarantine. For Bangkok, following the new wave, the Bangkok Metropolitan Administration, or BMA, has ordered the closure of certain entertainment venues from today onwards, Tuesday the 29th of December, until Monday the 4th of January next year, or after the New Year holiday season. This covers bars with hostesses, horse racing tracks, and cockfighting arenas, as well as other entertainment venues such as massage parlors included. These pubs and restaurants can stay open as long as they serve food and drinks and strictly observe food and drinks only, and strictly observe disease control measures and close by the time of midnight. In Krabi province, the governor there has designated Mueang district, except for PP Island, as a surveillance zone and signed the order to close down the following places in Mueang district from the 28th to the 30th of December. Massage parlors, except in hotels, fitness centers, pubs, bars, karaoke, snooker and billiard venues, schools and boxing stadiums and similar high-risk venues were also ordered to temporarily close until the 6th of January. Moving on to the number of cases and general situation that we have for today, and a slide will be coming up for you. New confirmed cases for today, we have 155 new cases, making the cumulative number of cases in Thailand to date 6,440, with total recoveries of 4,184. It is of great sorrow that we have learned of the 61st fatality, one additional fatality to the number of deaths. So the accumulated total of fatalities from COVID in Thailand is 61 now. Our sincere condolences when we heard this news about this new fatality, which is a 45-year-old employee of an illegal gambling den in Rayong province. The victim has actually had underlying health conditions, meaning diabetes, and tested positive for COVID on Sunday, 2 days ago, on the 27th of December. Some observations from the new cases. Out of the 155, around 134 are from local transmissions. Around 10 were detected within state quarantine. Active case finding in Samut Sakhon numbered around 11 cases in the most recent number. And the number of provinces affected is increasing day by day. The other day we were mentioning around the mid-30s. Now it is around 45 provinces, exactly 45 provinces, which include already Samut Sakhon province. So 45 provinces affected by COVID in Thailand. The majority new cases from local transmission. In terms of local transmission within Samut Sakhon, there is 12 cases. There are 12 cases from the Samut Sakhon cluster. From the Rayong cluster, there are 19 local transmission cases, and 10 cases of local transmission are still under investigation around the country. In Rayong in particular, as mentioned, the municipal area, the city of Rayong, is classified as Zone 1, but the surrounding districts in Rayong province, the districts surrounding the city center, are classified as in Level 2 in Rayong province. Therefore, of course, still necessary to remember these alphabets, these acronyms by heart. DMHTT, distancing, mask wearing, hand washing, temperature checking, and Thaichana, meaning using the application platform. The one important piece of information is about the creation of the Special COVID Operation Team, or SCOT, SCOT. Since the escalation in Thailand, the team realized, the medical staff in Thailand realized the importance of rapid search and emergency services for those in need. But due to limitations in highly controlled areas, this was quite a challenge. So therefore, the National Institute of Emergency Medicine established the SCOT, or the Special COVID Operation Team, to transport and assist patients during the climax of the outbreak. The main purpose of objective of SCOT is to provide support for emergency medical services, transporting COVID and general patients under the highest medical safety standards. It also seeks to prevent any disruptions to emergency medical services during the outbreak. As of now, we have around 1,800 personnel training for the SCOT team, which will cover around initially 54 provinces around the country. And those in need of emergency services can directly call the hotline number, which is 1669 for assistance. A little bit on the application, Moshana application, urging the public to download Moshana application as mentioned in the previous briefings on the other days. It's an application for contact tracing designed to contain local transmissions. The application is available both in the iOS and the Android mobile devices. It will also facilitate the operation of doctors and health personnel in dealing with the disease, as well as they will be quickly able to identify the potential risks and reduce the spread of the virus. And similar to the GPS system, Moshana will record the information and identify persons who have come in contact with COVID-infected persons using GPS and Bluetooth technology. On the vaccine, a little bit further, as mentioned yesterday, the government has signed a contract to pre-order 26 million doses of COVID-19 vaccine from the British-Swedish firm AstraZeneca, which will cover 13 million people. We are thus very pleased that with the news that the trials for the vaccine showed an efficacy rate of 90% when people were given half a dose followed by a whole dose at least 1 month later. This is indeed a promising sign and gives us hope for an improved COVID situation next year. The current wave, the new wave, as we see in the numbers, it's spreading and increasing at a faster rate than the previous wave earlier this year. Definitely, it is a more serious wave than the one we faced. Now it has reached 45 provinces, more than half of the provinces in Thailand. We therefore urge the public to comply with all measures strictly and seriously. Otherwise, the daily number of cases could reach 4 digits in the next month. As I mentioned, the worst case scenario as well. And whether or not the control measures will be intensified would depend on the effectiveness of and the compliance of our whole society, the whole of society approach, and how much the general public cooperates. If we continue to keep our guard up, there will be no need to enforce stricter laws or impose lockdowns or curfews as we have experienced earlier this year. I'd like to end with a tribute to our healthcare workers, our warriors in white gowns. They have been hailed as Persons of the Year by the English language paper in Thailand, the Bangkok Post. This recognition has been well earned and fully deserved, warriors in white gowns. And our dedicated warriors have worked tirelessly and endured long working hours, even till today, to race to contain this new and lethal virus. Many of them have not had holiday for months, and we're nearing holiday season right now. But they have spoken about their profession with pride and to protect the people's lives, the people living in Thailand, Thais and foreign nationals alike. By following the advice from the medical staff, and we've been working closely with our neighbors as well on information exchange and capacity building in public health. We, of course, can win this war against COVID, and you see an infographic there providing some information about our cooperation with our immediate neighboring countries. On the part of CCSA, we provide daily English and Thai briefings. For the English version, the archived version of the video clips each day in English can be found in the YouTube channel of the Ministry of Foreign Affairs or the MFA Thailand channel. You see an infographic that on screen. So it has all the English language video clips which you can view as a playback since the beginning of this year. It's also available in the Public Relations Department's Facebook page. Of course, as I mentioned yesterday, the namjai, or the outpouring of the heart, is a very Thai characteristic, and we will continue to do that. Of course, I'd like to say that we care a lot and we have love for Thai society and everyone living in Thailand. Therefore, we speak directly. We have love, so we speak directly. We care for the health of the people in Thailand, the friends of Thailand, so we warn you directly. เพราะความเป็นห่วงเราจึงเตือนแล้วก็มีการพูดตรงๆรักแล้วก็เป็นห่วง นะครับไม่พูดอย่างอ้อมค้อม we speak directly because we care for all of your health so that is what I would like to end with the spokesperson ended with that of course it's near New Year now and one mode of enjoying New Year for many Thai Buddhists is to pray across New Year over midnight during New Year but of course the way to do it now is online prayer online prayer during New Year is one way in which we can Thai people can find peace of mind during this difficult and challenging time which we hope that we will overcome together as one society so thank you very much for your attention today and have a pleasant afternoon and see you again tomorrow thank you สวัสดีครับ
ครับขอบพระคุณนะครับท่านณัฐพานุ นพคุณ